1.
Note card front, note card back. Bipolar disorder is a serious mental illness that causes episodes of depression and episodes of mania. Depression can consist of emotional symptoms, sadness, loss of interest in things you once enjoyed, feelings of guilt or worthlessness, restlessness, loss of appetite, anxiety, irritability, suicidal thoughts, and trouble concentrating or making rational decisions. Mania consists of extreme optimism, inflated self-esteem, poor judgment, rapid speech, racing thoughts, aggressive behavior, agitation, increased physical activity, spending sprees, increased sexual drive, decreased need for sleep, distracted easily, and drug abuse. These episodes commonly affect your energy level, behavior, ability to function, and your ability to think clearly or make virtual decisions. For example, people with bipolar may think that they have a relationship with someone famous, claim to be an expert in something that they really know nothing about, feel paranoid, or hear voices that aren't there. Some things to do to cope with your day-to-day life consist of going to sleep and waking up at about the same time each day, be active every day, not skipping meals or eating too much, take your medicines on time, and see your healthcare provider on a regular basis. Some things to do to cope with your life while maintaining a job are taking breaks, keep regular hours that let you get enough sleep every day, use personal planners or calendars to help manage your time, avoiding stress and other things that could trigger a mood episode at work, and taking care of your physical health. More than 3% of the U.S. adult population has bipolar disorder, most not even knowing that they have the disorder. Genetics also plays a role in this. Many people with bipolar disorder have at least one close relative with this disorder or with depression. Women with bipolar disorder have more depressive episodes, and men with bipolar disorder are more likely to have manic episodes. Neurotransmitters carry messages between brain cells. These brain activities are important because they affect thought, emotion, memory, and learning. Bipolar disorder can impair these functions and make it more difficult to go about your day-to-day routines. This can make it difficult for people to obtain a long-term job or a relationship. Although the exact causes of bipolar disorder may be unknown, just remember that it may be due to a chemical imbalance. Bipolar disorder is not a character flaw or a weakness. It is an illness that affects your brain and requires the appropriate treatment to help manage. Without the appropriate treatment, bipolar patients would become mental. People with bipolar disorder often have an abnormal thyroid gland function because too much or too little thyroid hormone alone can lead to mood and energy changes. It is important that thyroid levels are carefully monitored by a physician. People with a rapid cycling tend to have co-occurring thyroid problems and may need to take thyroid pills in addition to their medications for bipolar disorder. Medications for bipolar disorder are prescribed by a psychiatrist or medical doctors with expertise in diagnosis and treatment of mental disorders. Medications known as mood stabilizers usually are prescribed to help control bipolar disorder. Several different types of mood stabilizers are available. Generally, people with bipolar disorder continue treatment with mood stabilizers for an extended period of time. Other medications are added when necessary, typically for shorter periods of time. treat episodes of mania or depression that break through despite the mood stabilizers. Studies have shown that psychosocial interventions can lead to increased mood stability, fewer hospitalizations, and improved functioning in several areas. This is due to people not realizing that they obtain this disorder. Therefore, they do not receive the appropriate treatments needed. There is no cure for bipolar disorder. However, with the appropriate medical attention and treatment, this disorder can be easily controlled. With this in mind, if you know someone that has this disorder, please talk to them about it.